Hi, my name is Carol Wilkinson and I'm a developmental pediatrician here at Boston Children's Hospital. Our team recently published a paper in the Journal of Developmental and Behavioral Pediatrics where we systematically evaluated the consistency and variability amongst 4 commonly used developmental milestone checklists. It turns out that they're not very consistent with each other at all. And so why is this important? Well, developmental milestone checklists are used by both primary care providers and by caregivers to track and follow a child's developmental progress. And so the accuracy and the clarity of these milestones is important, both for early identification of developmental delays and then in turn access to earlier interventions. So what did we do? We took 4 commonly used checklists, 2 of which are used by primary care providers or in medical education, and 2 of which are available online to parents and caregivers. Using these milestones, we created a list of discrete, unambiguous, objective developmental observations that could be mapped to 1 or more milestones from the 4 checklists. We call this a relational database. You can go check it out here. Just going through this process of determining which milestones map on to which observations raised concerns for us about the utility of these developmental milestone checklists. For example, milestones from different checklists described similar skills but in different ways. Some milestones combine 2 related but really discrete skills. Other milestones seem to have the same description but with very different estimated ages of when they occur. When we analyzed our relational database, our concerns were confirmed. A total of 728 unique developmental observations were created, and these mapped on to 1,094 milestones from the 4 different checklists. However, only 40 of those 728 observations mapped to milestones that were present in all 4 checklists, and only 130 of those 728 observations mapped to at least 3 of the checklists. In addition, of the 130 observations that were included in at least 3 of the milestone checklists, 1/4 were mapped to milestones that didn't agree on the age at which the developmental milestone was supposed to occur. So what's the takeaway? These milestone checklists that providers and caregivers use to track developmental milestones just aren't consistent in the skills that they cover or the estimated ages that they provide. And from a clinical standpoint, this emphasizes the need to use validated screening measures instead of developmental milestone checklists at each well-child visit in order to identify developmental delays. But more importantly, I think these findings highlight a need for objectively defined and accurately normed developmental milestones. But how do we go about doing this? Well, integration of developmental observations into the electronic health record really would be an ideal platform for the large-scale data collection and analysis needed. And so to push this forward, on our end, we plan to convert our relational database into a standardized coding system that could be integrated into an electronic health record to improve both tracking of development and also facilitate much needed population-based research in the field.